Some of these programs that we've rolled out don't always have technology or glitzy buildings because we do believe that technology will never replace compassion.
When I started inspiring women, I had one clear mission to advance the next generation of women leaders. This show is for you. Whether you're climbing the corporate ladder, building your own business, or navigating the complex world of healthcare leadership. That's why I'm asking you to please take a few minutes and fill out our quick 5 question survey. Your feedback will help shape the future of this show, what topics we cover, which guests we feature, and how we can best support your leadership goals. Visit inspiringwomen.show/survey to share your thoughts. That's inspiringwomen.show/survey. Your voice matters, and I can't wait to hear from you. Now, let's get to today's conversation. This is Inspiring Women. I'm Lori McGraw, and I'm speaking with Deborah Visconi today, and she is the CEO of Bergen New Bridge Medical Center. She is a tremendously recognized leader for her leadership in terms of transformation, taking this organization and bringing it into the public sphere, providing an organization that is so important to the community. And we're now in times where the voices of women leadership at all levels is needed. Deborah, thank you for being on Inspiring Women.
Oh, thank you, Laura. It's great to meet you and your team. And thank you for having me on Inspiring Women. It's a privilege. Thank you.
All right. Well, let's dive in, and I want to start with transformative leadership. So, you were specifically chosen to champion the work that you're doing in New Jersey to take a hospital from a for-profit to a non-for-profit. It is a safety net organization for the community. So, just can you take us back to what was so important and critical at that point in time to lead this transformation, and why did they select you?
Well, well, look, I would start with this. This transition was about more than just a business model. It was about trust for the community, trust for our patients and our residents. You know, the previous leadership had left too many of our neighbors behind, prioritizing revenue over access. And our community needs a hospital that would serve everyone, regardless of their ability to pay, their language, immigration status, or circumstance. And that mission resonated deeply with me because I've lived it. Growing up in a Latinx household in an underserved community, I understood what it meant to navigate barriers and be overlooked. I was chosen to lead this change because I had the operational experience and the personal conviction to rebuild Bergen New Bridge into a true safety net hospital that's for the community, that's not for profit. And it has, the priority of engaging the community and serving the needs of our communities.
Deborah, can we talk about what you just said there? Because the personal conviction of lived in experience and sort of like all of the energy that is required to lead transformations at scale, that is critical. I work with so many women leaders who have the conviction, but you also talked about the operational experience. You have 30 plus years in terms of operational experience. So what were the key requirements there in terms of the foundational capabilities that you have that were so important to lead this transformation? Then we're going to go into a bit about what those transformations have been.
You know, I believe that my background is really inseparable from my leadership. Growing up, I saw firsthand how language, culture, economics can keep families from getting the care that they need. And that stayed with me throughout my career. And I've built my leadership, and my conviction all comes from that background. For me, the way I look at Bergen New Bridge, it's that equity isn't an initiative, but it's embedded in everything that we do. It's part of the fabric that we're made of. That's why we continue to expand our programs that touch our communities in areas that are so needed, whether it's the vulnerable communities, the Black and Brown communities, the LGBTQ communities, any community that needs access to quality care is where our focus is and how we build our programs. It's all around helping those that need the help the most. You know, behavioral health, addiction services, geriatric care, chronic conditions, all of the health pillars that are so important to our community is deeply ingrained in my belief and my leadership and how I approach the delivery of healthcare, but in now in my team that I've built over the last 7.5 years.
But Deborah, those things that you just talked about, I mean, just, behavioral health, opioid addiction and what you've done there, these other types of clinics, they all require resources and we're in tough economic times. So can you like speak to some of the like, how are you making those happen in a non-for-profit public service, entity that you have created? How are you making those happen? What skills are you bringing to the table with your team to allow for them? Because it has always been hard to lead health systems. Those times have only become harder in this economic climate based on new rules and regulations that are being brought upon us. What is it taking to actually continue to advance these transformational programs?
Well, I would tell you what it's taken is resilience, focus, courage, and a deep connection to those that we serve, really understanding their needs. And, I always say that we don't innovate here at Bergen New Bridge with glitzy towers and you know, glass buildings. We innovate around people.
Mhm,
We engage with our communities. We listen to their voices. We bring them to the table and genuinely deliver actions to our words. And the COVID pandemic was clearly one of those moments for us where we did just that. And the world was falling apart. People were dying at our doorsteps, but we had that intense focus to say that we are that beacon of health, hope, and healing that our communities need and rely on. And so for me, it's about that conviction. It's about that energy. It's about having this team around you. And whether it's the frontline nurses and lab techs and social workers, whether it's our doctors, our medical staff, our management team, we all share that same conviction of service. And we rally around, what is it that we're going to do today? And opening up a depression center of excellence. That didn't take a tremendous amount of money per se. It took
mhm.
doctors that wanted and believed in this. It took social workers and management leaders that believed in depression being one of the critical areas of need right now. People are suffering from depression. Our eating disorder center, same thing. We built a little space here right in our hospital where we can take care of people suffering from eating disorders. So it's really about that focus and that priority of what is it that our communities need from us. And that has been the driving force to get us where we are today and being a truly successful provider in our community.
I wanted to ask you, as a Latinx hospital leader, your entire career, you've prioritized underserved and minority communities. And that's led to national recognition for the work that you've done. So, how has the cultural background, the lived experience, how has that shaped the programs? How has that built trust in the people and communities that you're serving?
I believe it's built the trust because I've lived it and I walk the walk and I have walked the walk. And it's demonstrated in everything that I do. It's demonstrated in my outreach to the community. And, my title is Chief Executive Officer, but I really view myself as Chief Engagement Officer because this is how I engage with our communities, to learn from them and they learn from me and to deliver on that. And the trust started from day one when I walked through the doors here. And I listened to the people. I listened to the team that was here. I listened to the communities and I deliver and we create programs and we follow through with things. My phone is always on, and I will answer my phone 24 hours a day for anyone that needs assistance or advice or guidance. And all of that is, demonstrated again in our actions, speaking louder than our words. So I really do think that my background plays a tremendous part in how we approach the needs of our communities and how we prioritize our efforts and our resources.
Has anything changed, Deborah? I mean, equity and access has always been sort of one of the pillars for, what makes for excellence in a health system. But things in these times, equity is a word that has become polarizing and problematic in ways that I don't agree with, but yet it exists. Has that changed, or has the political climate or the social climate changed how you prioritize equity and access? Do you use different words? Do you change anything about how you deliver, plan, or lead, just because of the times that we're in?
Um, Mostly no, things haven't changed because I firmly believe that equity, diversity really equal excellence and really equal quality of care delivery. So, we do stay, of course, we pay attention to what's out there. We don't, want to do anything that's inappropriate, but it really is about focusing on the delivery of the highest quality of care and the excellence of that delivery of care. And that's how I look at it, because being able to provide what I tell my team is we're providing equitable care, right? We're providing access to everyone. We don't just focus on one population. One of the things I did when I first got here was I made sure that we provide access to any kind of insurance that's accepted in the state of New Jersey. So regardless of whether you have insurance or you have good insurance or bad insurance or any insurance, we provide access to everyone because this is my firm belief that we are here to be here to help people, to heal people, to be that, as I said before, that beacon of health, hope, and healing for people, regardless of any matter. And we rally around and we focus on delivering that care with the highest quality capabilities that we have. So I guess the answer is no, but a little bit of yes. Of course, we're always looking and seeing to make sure that we're aligned properly, but we really are focused on our mission of providing that care. We're a
Well,
safety net.
I love the hope, the hope, health, and healing, approach that you have. Maybe we can talk about some of these transformational programs that you put forward. Just a level of strategic growth for the organization, and they require quite a bit of innovation. But I want to talk about some of the impact. So you put forth, you were talking about your Depression Center of Excellence. You put forth a non-opioid pain management program and others. Can you pick any one of these innovative programs, Deborah? Maybe you can talk about like how they actually are impacting the members in your community.
So the way I mentioned it before, but I would say that, balancing innovation with humanity, right? And some of these programs that we've rolled out don't always have high glitzy, technology or glitzy buildings. But, because we do believe that technology will never replace compassion. So it's really about the team that you've built and the lens that we use when applying decision making to innovating with purpose. So if I were to look at, let's say, our Center for Comprehensive Addiction Treatment, for example, that's the
Mm.
population that suffers from addictions, whether it's drugs or chemicals or alcohol or whatever. That really was about looking at the patient as the center of our universe and understanding that people with an addiction disease is just like heart disease or cancer, like any other disease, and they can't all be treated the same way. So the Center for Comprehensive Addiction Treatment is a holistic approach to that particular population. So they'll go into the beginning of the what I call the oval here, where they get assessed. And every individual doesn't respond to treatment the same way. So then we decide where this person is best suited to be treated, whether it's an inpatient or an outpatient or some other type of setting. And then we funnel that person through the care path with the outcome always being the warm handoff. So we can't put people out into the community without a great discharge plan. And so we always look at the way that warm handoff will occur, and each person is treated as an individual. And so, the CCAT is a perfect example of that holistic, innovative approach around a person. Similarly, for our Depression Center of Excellence, again, people are suffering from depression. Not everybody responds the same way. So we took all of our experts, our psychiatrists and our social workers and our therapists and our counselors, and we put them in a center. And so someone with depression comes into the entry point, and it could be that that person just needs counseling, or that person needs medication, or that person may need something called TMS, or that person may need ECT treatment. But it's all available in that holistic hub of care with the patient at the front of it. Should I keep talking about more
Yeah,
stuff?
well, I- I'm sure you can talk about a lot more stuff. I'd actually like to hone in on that, all these innovative programs, the point you led with, which is technology can't replace compassion. And I think we're living in a time where compassion is becoming less available than it historically has been. So as a leader who has lived experience, how are you ensuring that compassion remains throughout New Bergen in terms of your culture and your approach to the people that you're serving?
Yeah, that's my daily job, really. My daily work is making sure that we again keep that patient and that family in the middle and the center of everything that we do. So I would say my playbook rests on three pillars. One is partnerships, because we can't innovate in isolation, and collaborations with universities, tech companies, community organizations. These bring fresh ideas and resources to us. So that's partnerships to me, and relationships is one of my top pillars. Training, education. We want to make sure that our team is equipped to embrace that change, not to fear it, but to embrace it, and innovation being part of their professional growth. So listening to the voices of our frontline teams and what do they need to be able to be successful in their workspace. And then redefining what success looks like. So we don't just look at financial performance, and you probably won't hear too many CEOs saying that. But
No.
yes, of course, the finance pillar is extraordinarily important. We are a safety net, but we don't just look at that. We measure our success in reduced disparities, better outcomes, stronger community trust, and those relationships that are just so important to be successful. So it is definitely a, a work, really a labor of love to make sure that we are there and everyone's involved, all levels, all inside, outside, all relationships.
We'll be right back with more inspiring women after we take a quick break. Hey, Lori here. If today's episode resonates with you, would you mind sharing it with a friend or a colleague who could use some inspiration? Just hit that share button in your podcast app. That's how we grow this amazing community of women leaders. You can hear the passion in terms of like how you're bringing it and keeping compassion and keeping the how you deal with the whole person front and center in terms of the work that you do. It really is remarkable just
Thank
to
you.
hear you, Deborah. I really appreciate it. I want to talk about leadership. I want to talk about building the next generation of women leaders. You are a well recognized leader for all the work that you've done. You've been awarded as a national woman leader, as a Latinx leader, all of the things. And I know that this is important to you in terms of also ensuring that the next generation of women leaders have what it takes to lead in today's world. So, if you could just talk about sort of like what maybe some of the systemic barriers are that you see. And then what do you think is important today for women to be the leaders like you, Deborah?
Yeah, well, as you can tell, I am passionate about building the future healthcare leader, and in particular, bringing women up. I do believe that there are barriers that women face that many times we don't even realize that we're facing them, and they're invisible, but they become our way of life. I've been passionate about dismantling those barriers, that lack of mentorship, the unequal access to opportunities, the constant pressure to prove yourself. And, these things really do exist, and they exist today. And for me, I like to just make people aware of that. Right. So at my hospital, at Bergen New Bridge, and throughout my entire career, but obviously now I have the opportunity to do it in a broader way, implementing sponsorship programs that go beyond mentorship, implementing mentorship programs. We just started here a leadership academy where we're really investing in our future leaders, our pipeline. We make sure that women are not just guided, but they're actively advocated for in promotions and opportunities. I think those things are really, really important. I have a technical background. I'm a lab tech by background. I started my career as a phlebotomist and a lab tech, so I've grown really a grassroots career. And it takes courage to take those steps and to make sure that you're heard and to try to not be afraid to use your voice, and there's that old adage, if you're not given a seat at the table, bring your own seat or build your own table. I prefer to build my own table. Um, but that's true. It really is. And women just historically just are always more unassuming, and they tend not to be courageous. And I think for me, it's always been that, because I lived it, and I don't want others to live it. So I want to give the younger women, the next gen, my colleagues, my executive team, that ability to be at the table. I embrace that. I encourage my team to go out there and be speakers and to be recognized. And we're always nominating our leaders, women, a lot of women, to be recognized by different organizations. So, it's there's not one size fits all, but I think it's an awareness that there is differences and that there are barriers. It's really recognizing it and doing everything that we can as leaders to remove those barriers and to facilitate that conversation and to encourage people to be be courageous.
And it takes work. And so I think that your points and advice for, the emerging, women leaders or leaders generally in terms of what they need to do, get the seat at the table, be courageous, take advantage of the opportunities. But you also pointed out, what are some of the problems that I think are just very real. And we've had, for women in particular, a leaky pipeline of mentors and sponsors. Just the higher up you go, there are fewer of the women, ones to follow or being pulled from. And those problems, unfortunately, are only becoming worse. We're seeing working mothers drop out at alarming rates these days. Right now in healthcare, we know that women are making, they're controlling the purse strings in terms of the decisions that are being made for their families, but not for the larger decisions for organizations. So we know these things. And so, Deborah, with that knowledge and with all of the leaders that you work with, not just the ones that you're mentoring, on the emergence side, what are you asking of them? We're all busy. We all don't have room in our day to do more. But what are you asking of leaders to do to solve some of these leaky pipeline or other issues that are obstacles for women's advancement?
I think, be visible, be present, be supportive, be engaging. Um, you know, Tap the people on the shoulder that you may not always think to tap on the shoulder. There are 7 CEOs in your organization today, and they may not be the people that you think they are. And find those people and encourage them and give them growth opportunities and give them mentoring opportunities. Um, I do think that, again, back to the courage piece, I think it takes courage for both sides, not just the individual, but the people that are in leadership positions. Be courageous to open the door to others. To me, it's like I want everyone to be smarter and better than me. I don't plan to be, working, forever. So I want the future to be representative. I want people to have a healthcare system that doesn't ask people to choose between excellence and equity, right? Because those things are inseparable. I want to build that system around leaders that are working with us and for us today.
Well, I think those are incredible words of advice and encouragement, and you're demanding, and I love that because we need more leaders like you at the level that you're at to be demanding of others. Deborah, as
Yes.
we close out this Inspiring Women interview, you have many years of leadership. Of impact. You've done incredible work to create Bergen New Bridge to be the safety net that it is in New Jersey. How do you think about the legacy that you're leaving? And what do you want that to mean to future generations?
I want to see leadership not just about fitting in, but about lifting others up. It's about bringing up people. I want future leaders to see that they belong at the helm of major institutions, in particular women and, of course, Latinx women. I want the future healthcare to really look at the holistic individual. I want our future leaders to build that healthcare system that is a holistic approach to the human need. And I want my legacy to be one of inclusion, one of respect, and one of extraordinary relationships.
This is incredible. This is an amazing conversation, Deborah. Thank you so much for sharing this information and these powerful words. This has been an incredible, inspiring women conversation. Deborah, thank you so much.
Thank you for having me. It's great to be here.
And you're demanding, and I love that because we need more
Until
leaders
next
like
time,
you at the
keep
level that you're
inspiring
at
women
to be
and
demanding
being
of
an
others.
inspired woman.
Deborah, as we close out this Inspiring Women interview, you have many years of leadership, of impact. You've done incredible work to create Bergen New Bridge to be the safety net that it is in New Jersey. How do you think about the legacy that you're leaving, and what do you want that to mean to future generations?
I want to see leadership not just about fitting in, but about lifting others up. It's about bringing up people. I want future leaders to see that they belong at the helm of major institutions, in particular women and, of course, Latinx women. I want the future healthcare to really look at the holistic individual. I want our future leaders to build that healthcare system that is a holistic approach to the human need. And I want my legacy to be one of inclusion, one of respect, and one of extraordinary relationships.
This is incredible. This is an amazing conversation, Deborah. Thank you so much for sharing this information and these powerful words. This has been an incredible, inspiring women conversation, Deborah. Thank you so much.
Thank you for having me. It's great to be here.
Until next time, keep inspiring women and being an inspired woman.